So before I go to the qualitative research appraisal, I think, okay, or I will show you these two things. There's a protocol. We are sharing a draft protocol also with you. Those of you who are planning, or we have shared it with you. So this is one of the protocol, and you can take help from this protocol to make your own protocol. If you are planning to submit a protocol, and we expect that please do submit after you attend this qualitative research method, then all of you, those of you who have not submitted or who have not planned yet to conduct a qualitative research, please think of a research question and carry out and submit a research proposal for ethical approval in your institute. So now these are the following sections of any qualitative research proposal. So when you plan to submit a proposal, you need to have these many sections in your proposal. The first thing is the problem and purpose. We will see it in the original protocol. Then you have got the research question. Then you have the research approach, like a special, if you are doing a qualitative descriptive, or you are doing a phenomenology, grounded theory, narrative research, whatever you are doing, you should mention it. Then you will write the researcher background, belief, and biases. That is very important. We talked of those biases. Why you should write it. And then you will write about the population and the participant. In many manuscripts, you have seen that they write about the setting also. Like in what setting, if they are doing it in the hospital or in the community. So they write the study setting, and then about the participants. Then they write about the sample size. So you can mention about the saturation. You can write about the purposive sample or whatever. In one of the article, you have seen that they have taken the stratified sampling to have representation from all the sections. So what sampling technique you have used, you have to write that. Then how you did the data collection, what method of data collection you are going to use, like whether you are doing observation, you are using observation, or you are doing the triangulation of the data collection, like FGD, in-depth interview, maybe the observation, then how you are going to process the data, and then how you are going to analyze the data with the software, or you are doing a manual analysis, or then about the quality assurance. You have to mention, we talked about that member check-in thing that should be mentioned, and then you write about the ethical consideration. So these are the broad, rather if I say, headings of the research proposal. So research question, the first was the research problem and purpose. Problem purpose you mentioned, like many article, you must have gone through it, and in quantitative proposal also, you know that how to write it. Research question, like in this case, you write the research question with the how, why, and what. You don't write like a quantitative one. So here you write like, how does social stigma influence help-seek behavior among teens? Why do students not attentive in class? How doctor-patient relationship is getting affected by the communication skills? How people reach a decision making to take vaccination or not? In the research approach, you have to mention the purpose of the study, choose appropriate research approach, mention what kind of data you are planning to address in the research question, and mention about the source of the data. So now just few questions. All of you please type in the chat box. What will be your research project approach if you're planning to collect a participant story or capture a group of participant stories and retell their stories? What will be the research approach? Please write in the chat box. Narrative research. Very good. If you are planning to capture participants' experience and examine how they make sense of their experience. Yes. You are planning to develop an explanation, model, or theory that helps an understanding of a phenomena, situation, or process. Grounded theory. Very good. You are planning to study a group of people in their natural setting to study your research question. Ethnography. Good. So this was the overall, and then framing title of the report. So in framing title, like I said, that you can use one of the participant quote to frame a title. Like you can see, one of you can read this. Mrinalini, can you read this title?
Okay. So shall I read, ma'am?
Yeah.
If I don't eat enough, I won't be healthy. Women's experiences with gestational diabetes mellitus treatment in rural and urban South India.
Okay, so here you can see they have used the quote as a to substantiate the the experiences of the gestational diabetes. Yes, any other person? Latika, I can see your name.
Yes, ma'am. Is there a medicine for these tensions? Barriers to treatment seeking for depressive symptoms in rural India, a qualitative study.
So then what is the message? By seeing these title, that when you read the transcript, have this thing in your mind that you have to select few quotes which you can use and which is more suitable for that particular research question which you have thought of. So you can select few quote also and keep it in a separate Excel sheet, or at one place you can mention those quotes or maybe highlight them so that you will use those quotes in your title. Yes. Ashwini, can you read this?
Yes, ma'am. We sold the buffalo to pay for a brain scan, a qualitative study of rural experience with private mental healthcare providers in Uttar Pradesh, India.
So you can understand the plight of a person, that buffalo was the life, maybe he that it is a livelihood for that person, but for a brain scan he had to sold the buffalo. So this is, if somebody reads this, then the overall he starts imagining things, and that is a more of a imagery which you have to project in the article. Whenever you read a qualitative article, the situation should come to the mind of the reader, so it should be like a imagery which is there in the stories. So that's how that title should be very catchy when you frame a title.
Ma'am, I have a query. Can I ask?
Yeah, please.
Ma'am, as we are submitting the research proposal first and we are getting clearance from the ethical committee. So later on, these responses we will get after our studies completed. So can we change our title later on?
Yes, what you can do, because we also do this, these things come, you are very right. Initially you submit the proposal with some title and later you refine your title. You can communicate to your IC like we do. What we do, we communicate it through mail that this was the IC reference number and we got approval with this title. But since after drafting the manuscript and going through the participants' responses, we are changing the title. So you just have to intimate the IC.
Okay, thank you.
Yes, Nilima, can you read this?
Yes, ma'am. Everybody expects the perfect baby and perfect labor, and so you have to protect yourself. Discourses of defense in midwifery practice in Aotearoa, New Zealand.
Thank you. Yachna?
Can I read, ma'am?
Yes, please.
My husband is my family, the culture of pregnancy disclosure and its implications on early pregnancy registration in a child nutrition intervention in rural Maharashtra, India.
Thank you. So I'm not explaining because these, just to show you the titles, I'm asking one of you to read so that you will understand how the use of quote is there in the title. Manisha?
Yes, ma'am. The body seems to have no life. The experiences and perceptions of fatigue among patients after COVID-19.
Thank you. Mugdha?
Yes, ma'am. In short, we will deport you. Disrupted temporalities of migrants with HIV in Russia.
So you can understand this quote is so small, but so apt. We were discussing that you should not go by the length of the quote. And even such short quote and phrases. In title, you should try searching for such short quote, because in title, you cannot have a very long quote. So the short quote and apt quote will help you in framing a title. Monica?
A Cry in the Dark, a qualitative exploration of living with cluster headache.
This is also so good. A Cry in the Dark, a very short and apt quote. Arifun Hera? Can you hear me, Hussain?
Yes, ma'am. Am I audible, ma'am? Hello?
Yes.
Yes, ma'am. Am I audible, ma'am?
Yeah, you are.
It feels like sending your children into the lion's den, a qualitative investigation into parental attitudes towards ASD inclusion and the impact of mainstream education on their...
Yes, it is not full. Something is missing, but you can we wanted to emphasize that it feels like sending your children into the lion's den. So that's the perception of the parents when they send their children to the mainstream school. Yes, who will read this? I cannot see the name. Maybe Dr. Shamshad, can you show? Down. Parul, are you there? No. Mamta, can you hear me? No. Veena?
Yes, ma'am. No one says no to money, a mixed method approach for evaluating conditional cash transfer schemes to improve girl children status in Haryana, India.
Good. Then I can see, you can go down. Surendra Shivangi. Shivangi?
Ma'am, am I audible?
Yeah, you are.
We do not dare to love women with disabilities, sexual and reproductive health, and rights in rural Cambodia.
So we do not dare to love. This also you can understand the plight. This Mohan Das?
Yes, ma'am. It is just like having a period with back pain, exploring women's experiences with community-based distribution of misoprostol for early abortion on Thailand-Burma border.
Thank you. Mrinalini?
Yes,
Can you hear me?
Yes, ma'am. For every illness, there is a cure. Attitudes and beliefs of Moroccan Muslim women regarding health, illness, and medicine.
Thank you. Nitesh?
You started something, then I continued by myself. A qualitative study of physical activity maintenance.
Thank you. So we are done with the title, how to frame the title of a qualitative research. And for that, the take-home message is, while you are reading the transcript, you should select some small apt phrases or quotes, which is very much in match with your research question, the main theme which you are trying to, and maybe this will not come with the first, when you are doing the coding for the first time, it may take 2, 3, 4 reading to reach to such apt phrases. Because title is, I think it is very difficult to decide for a title. So this should be done once you have framed your manuscript, and then you should come to the title, what to keep. Now, this is a checklist for the qualitative research approach.
Ma'am, I have a query.
Please.
Ma'am, is it necessary to take the code from the verbatim only, or we can take the code alone?
No, I think that if you are quoting, then it should not, because it is in the bracket. Every title you have seen that they are doing the bracketing. So if you are taking your own quote, then don't put that in bracket. Can you see here? You started something. Don't put it in you can make your own quote, but don't put it in bracket. You can have like anything which you have interpreted, but write it in a running sentence. It is not necessary that you will take quote from the participant. But if you are taking quote from the participant, then you have to put it in bracket, and whatever quote we have shown here, that was the quote of the participant, but it is just one way of the title. You can interpret or you can make your own words and frame a title. No issues, no problem with that.
Present it to the ethical committee, no ma'am. The title should be approved and then only we can study.
I said that you can have, because these titles will not be there in the beginning. These comes after you have drafted your manuscript. So you can communicate to your IC, mail them that there is a change in the article, change in the title of the article. And that's okay, because it works with us also. We change methodology also. Here, I mean, many times there is a change in methodology because of some reason. And especially you must have seen this during COVID. A lot of theses got changed only because of COVID, because patients were not there. So it is only that you have to communicate it to the IC and just follow that communication, maybe. That works. Is this the question which you want to ask, or do you want to clarify?
Yes, the same thing I wanted to ask. Okay.
And you are just upgrading, you are not changing research question, nothing you are doing. You are just changing your article. So that is very much accepted everywhere.
Title later on, ma'am.
Yes, you just have to communicate. See, communication, if you communicate, and then the same you can show it when because many a time you have to submit that ethical approval letter to the manuscript journal. In that case, you can show them that mail, or you can get a new up. I don't know about how your IC functions, but they may issue a new with the same IC number, issue a letter with your title which you have asked for.
Thank you so much, ma'am.
So this is any other query on title? And if in case if it is not possible to I mean that approval you don't get, then you carry on with the existing title. But generally in my institute it is not a problem. I don't know about the experience of other people, but I don't think that there will be any problem in this. Okay, because we do every sort of change. The only thing is the communication. If you communicate, that is okay. So now let's discuss about this Core Q32 checklist, this appraisal. And after drafting my manuscript, you should use this checklist for completeness. And I will show you the final PDF of this Core Q once I discuss all these components. So this checklist, the first thing is the research team reflexibility. Research team and about its reflexibility. So introduce the research team, like you have seen in one of the article, I think in that ethnography article, what they have written, their background also in the public health or in the sociology or in the medicine, and then they write their training, trained in what or not. And reflexibility is about the explaining your personal preferences and bias, which we talked of. This we call it as a reflexibility. So the author should write about their reflexibility. Then you should write about the study design and analysis, and this in the research team and reflexibility, we have talked this. In the study design, you have to write the theoretical framework, the participant selection, how you are going to do that, and setting. This all is there in the checklist. Okay, so I'm just taking those points from the checklist, and then analysis and finding, you have to show the data analysis and the reporting. So domain 1 in the research team and reflexibility, I will show you, it's better to show you the PDF form because that will take less time. So the full form is consolidated criteria for reporting qualitative research, and which is called as the Core Q, a 32 item checklist. This is for interviews and focus group and also for the manuscript. So this is the checklist criteria. So first is the research team and reflexivity, in which the first is the personal characteristics. So the personal characteristics will be of the interviewer, which author conducted the interview or focus group. You must have seen this, that they write that the first author did this or the second author. Then about the credentials, what was the researcher credentials like PhD, MD, occupation, what was their occupation at the time of study, gender is also important, and then experience and training. What experience or training did the researcher have? Then the second point is the relationship with the participant. In this, was a relationship established prior to the study commencement? What do you understand by this? So this tells that the relationship means how the author tried to contact the participant, tried to invite them for the interview. The second was the participant knowledge of the interview. So participant knowledge, what did the participant, they know about the researcher? And then the third one is the interviewer characteristics. So in the interviewer characteristics, what characteristics were reported about the interviewer or facilitator, like biases, assumptions, reasons, and interest in the research topic. So this was for the domain 1. The domain 2 was regarding the study design. So this is a theoretical about the framework, the methodological orientation, whether it was a qualitative, descriptive, grounded, ethnography, phenomenology, content analysis. But in the participant selection section, there are 4 components: sampling, method of approach, sample size, and non-participation. So how many participants selected, like purposive, convenience, consecutive? In this participant selection, we always try to invite more number of people, because in the last moment, there will be a scenario when the number of people whom you have invited, they will always be lesser than the the total number which you have invited. And then the method of approach, how the participants were approached, face-to-face, telephone, mail, or email. Then regarding the sample size and non-participation. So you have to cite the reason for non-participation also. So you can make a call to them, the people who did not come or who did not participate, and you can ask for the reason. And then you should cite the reason of the people who did not come for the interview or focus group. Then regarding the setting, you should explain well regarding the setting of data collection. Where was the data collected, home, clinic, or workplace? Or was anyone else present besides the participant and researcher? And then description of the sample. What are the important characteristics in the sample, like the demography and the date? Then comes your interview data collection. So you have to write about the interview guide, where questions, prompts, guide provided by the author. Was it pilot tested? Were repeat interviews carried out or not? If yes, how many? So this repeat interview is only in that context where when you don't understand something, then you go back to the participant, and many a times you do it over telephone. You ask for some clarification. So for that, only we do a repeat interview. It is not like administering the whole questionnaire to the same person. And then the audio visual recording. Did the research use audio or visual recording to collect the data? Were the field notes made during the data analysis collection? What was the duration of the interview, or FGD? So they write that each interview, you can give a range of the interview, because if you are taking 20 in-depth interview, it may range from 30 minutes to 1 hour, or you can give the average time. So both ways it can be done. And then you can mention about the data saturation and the transcript return. So you have to return the transcript also to your, which we call it as a member check-in, to your participant for any comment or correction. Then the domain 3 is for the analysis and finding. In the data analysis, you write the number of data coders, how many data coders coded the data, description of the coding tree, derivation of theme, whether you identify whether it was an inductive or deductive, what software you used, how did you do the participant checking. This is same as the member checking. Quotations were the participant quotations presented to illustrate the themes or findings, with each quotation identified, like participant number. Data and finding, whether consistency between the data and finding, were major theme clearly presented in the finding, and is there any description of diverse case or discussion of minor themes? Because this is also very ethical issue. If there are minor theme or some diverse case, you should not leave that particular case. because you are presenting the perspective, the multiple perspective or the multiple reality. So even if it is a minor theme, you have to present it. So this
Like
is the
what, ma'am?
32. Yes.
Like minor theme in the sense like what, ma'am?
Minor theme, like I said in the beginning, when I was showing this code book. So there are 8 codes here. So if like my biases is like, I will highlight most of the time, if I am in favor of conventional teaching, I will not mention, or I will mention a very less about the digital checking or digital teaching. So minor themes will means only 1 or 2 participant has said it. That adverse, maybe 19 has said the same thing, but 1 person has said something different. So that will be as a minor theme. So this you can have, that means number doesn't matter here. We cannot say that if the 19 participants are saying this thing, that is more important than the 1 person who is saying the opposite, maybe contradictory thing. So that contradictory thing also, or the contradictory statement also, you should mention in your manuscript. That we mean by minor theme.
Okay, ma'am. Ma'am, and one more thing, ma'am, in the checklist also, can you just display the checklist, ma'am? In that, one of the things was clarify transcript. That is, we return the transcript to the participants.
Yeah.
Is it like usual? Sometimes it happens. It's not a usual thing, no, ma'am, or
it should be done, because frankly speaking, we could not do it, but because the participants, they were, but you should try doing it. We did not do it in one of the qualitative, in both of the qualitative research, we did not return the transcript to the participant. But you can do it with, at least with the medical students, with the like maybe some position holder, or if you are interviewing, like we did it with SIO, that is the State Immunization Officer, or the DIO, you can return the transcript to them. And generally in the Western culture, they do it, and we should also do it. We are not doing it, that's a separate thing, but we should do it. How? Like we are also planning this time that we may send it to them through, maybe through mail, because that email and WhatsApp, many times the participants, they don't have it, but you can send them the Hindi version, that this is there, this thing. And if that is for the that's ethical, they will not say later part. We are sharing one article with you which is regarding the hysterectomy, the perception of hysterectomy, and you will use this checklist when you will apply this checklist over that article, and then you will realize many times we are not doing everything which is there in the checklist, but this checklist is just to ensure that you are very sound in all methodological issues. And 1 or 2 things you may leave if it is not feasible, but at least you mention that, member checklist was not done, or it was done, so that the person or the reviewer, he will come to know that about that there is something exists like member check-in or participant check-in. That is also very important.
Okay,
like accepting your own limitation. You can write in the limitation of the study that we tried doing the participant check-in, but we did not get the responses back. Okay.
Okay, ma'am.
So that will reflect that the importance of member checking, that it should have been there, but because of this reason it was not there. Any other question up till this point?
Ma'am, regarding member checking, like once we send the transcript to the participants, and they what type of feedback are we supposed to expect, ma'am? Like if they give a feedback, are we supposed to incorporate it in our manuscript, or this is just to give them reassurance that their transcript was not used wrong?
Yes, no, I'll tell you. I was taking an interview of SIO, okay, and maybe he said something which I incorporated in the manuscript. Then later when I say, I did not send it back, but he told me that not to include that particular verbatim which he used, because he was criticizing the administration. So he said that please do not use that quote, or do not. So then I cut that quote from my transcript, because he immediately realized that he said something wrong, which if I will use, and maybe SIU is a responsible position, If I'm writing something that SIU said this about the immunization program, then it might create, some media attention and all those political things. So many times what the participant, or if I see while doing the narration, today's article, you go through that article. If you are doing a narrative analysis, if the person is telling some story, and maybe later, if he, in the flow, if you are a very good interviewer, he said something initially, because while he was talking, he did not realize. Later, he realized that he should not have said that. So if he want it to be deleted, it is his right. Okay. In our country, people are not that much aware, and that their voices are, maybe they think that their voices are not that important, or we also take them like that, they are poor people, or they are disadvantaged, or maybe what will they do? Will they understand or not? What where will they give the feedback on that? That is a separate issue that we are assuming. But let us do our part. We should, although I'm accepting that I did not do it with the patients, with the clients, but at least you can start doing it if you're doing something on the medical student, or you should send them back the transcript and the paper manuscript also, which you have drafted. Manuscript is difficult maybe in our setup because it is drafted in English. And, if we are sending them the English version, I don't know, maybe you can get it translated, but at least you can mention in your methodology that you did not do it. That was the limitation. Okay.
So just one more thing related to, as in, like, now you had mentioned about the administrative issues sometime which can come up after this thing. How to handle those things, ma'am, when we are going to write a manuscript? Certain times, if we are taking interviews of administrative people who are going to implement that particular policy or whatever, and they are giving up certain things, maybe sometimes they may hide, but a few of them, if they are coming up with certain things which very openly they say.
So then don't give any identifier. Just write the participant, because in one of the article you have written that participant number 7 or number 8. So if there is no direct identifier, there is no problem.
In certain cases, there'll be only few healthcare people who will be involved in certain particular policy implementation. Maybe 7 to 8 of them, doctors and few nurses.
Doesn't matter. Nobody knows whom you have interviewed. You just explain the context, the place, and everything. And if you think that it is going to raise some controversies, then you may take a call. It is entire your choice. In my case, I said that he asked me not to include it because we don't want to politicize anything. It's not our intention. Okay. So if that thing is coming and you are anticipating, then it is your call whether to have it or not to have it.
Okay, ma'am.
Again, for that, you can, if you want to incorporate it, you can incorporate, and then you can send the draft of the manuscript to the person also, with whom, like if it is 8 of them, it is an easier task for you. You can send this draft to each of them. And then if they are asking something to delete, or if they are not in agreement, then you can delete that particular section.
Okay, ma'am.
Ma'am.
Yes.
Discussion. Can we compare our findings to a quantitative study, ma'am?
Generally not. But again, like if, but that abstract code, how will you compare it with the quantitative one? Can you give some example? Like in this case, maybe like this research question, conventional teaching versus traditional teaching. If somebody has already done a quantitative thing questionnaire setting, and you are in your this thing also, if you are finding that 90% of the students are saying this, then you can quote that because it's a research only. So especially in the mixed method study, because you have the quantitative counterpart of the qualitative one. So in mixed method, you are free to compare it with the quantitative finding also. Okay, so this was the checklist. So these are the 2 exercises. Before, let me show you the protocol also. There's one protocol which will be shared to you Or no, sorry, I will correct myself, which has been shared to you. So this is research protocol. I have already opened it, I guess. So this was the protocol. There's a background. You can go through it and you can use this while you draft your proposal. Then about the research staff, that you are seeing that they are explaining the research staff, and then methodology. Few of the things are missing also. Then study locations, then study design, eligibility, recruitment, about the healthcare staff, about the community members, data collection, how the data collection will be done, and then data analysis, how the quality assurance will be ensured, what are the ethical considerations, and how we are going to protect the privacy and confidentiality of the participant, what are the plans for obtaining consent. And we have mentioned this reimbursement because it was a funded project. Because in case your project is funded, you can do some reimbursement to the participant because you are taking their time for the interview, they are coming, so you can try doing the reimbursement. And then about the dissemination plan also. Because it was a funded, that's why we did it. These are the references, and then then all the interview guides are there. Here, participant information sheet, that is there with you, so you can go through that. Then one more, I think before, this was one article. And we have shared this article also, which transcript we have used to show our theme and category. So this was the article, Refused and Referred, Persistent Stigma and Discrimination Against People Living with HIV/AIDS in Bihar, a qualitative study from India. So since it was a qualitative descriptive, but we use some concept of grounded theory, that is only axial, but actually, truly speaking, we did not use grounded at all. It was a qualitative descriptive. But this again, you can see this refused and referred. This was not the quote, but this was the interpretation which we interpreted. That's why we have not put it in the double comma. So like one of the participants was asking, now can we write in the title without a quote and taking our interpretation? So you can see this, refused and referred, persistent stigma and discrimination. So this refused and referred was our quote. This was not the participant quote. Is that right? Okay, so I will show you the research title. This was the title which we got published, and I will show the actual title. So actual title was this: Perception of Care and Treatment Among HIV Positive Patients Accessing ART Treatment in Bihar, a Qualitative Study. Okay, so this was the actual title when we submitted the proposal, and this was the title when it got published. So can you see there is a difference? But there is no problem with that, because we intimated to the IC, our IC, that we are changing the title, because after drafting the manuscript, we think that this is more appropriate. Okay. So if we are done, we can take 5 minutes break and then we will be back to the session.